Welcome to Health Digest, your authoritative health show. I'm your host, Dr. Mercy Korir. Now, today we are looking at cardiovascular disease and COVID-19 and the concerns that are around the various cardiovascular diseases. And here we are talking about hypertension, we are talking about peripheral vascular diseases, we are talking about stroke, we are talking about heart attacks, we're even talking about congenital heart diseases during this time of the COVID pandemic. Now, remember that this group of persons have been classified as a vulnerable group, people who are at highest risk of getting the COVID-19 and suffering severe to critical illness. And even from the Ministry of Health's data, a majority of the people who have succumbed to COVID-19 and its effects are people with one or two or different forms of heart disease, hypertension ranking the highest. And we know that 1 in 4 people across Kenya have hypertension, and they may not even know that they have it. And fewer people even are on treatment for this hypertension. Now, to have this conversation, I'm joined by Dr. Karemi Nguchu. Dr. Nguchu is a consultant cardiologist and an executive member of the Kenya Cardiac Society. Also with us, joining us via way of phone, is Mr. Edward Konzolo, who was a teacher, that is up to the year 2012, when he suffered a stroke due to a previously undiagnosed high blood pressure. And we start with Daktari just to give us an overview of why this particular cardiovascular disease, hypertension and the like are a concern during this COVID-19 pandemic. Dr. Karemi, welcome to the show. Now, as I've started and I was asking, why should we be concerned about heart disease, about the various cardiovascular diseases during this time of the COVID-19 pandemic?
Thank you very much for inviting me to the show. The reason that we should be concerned is because these are chronic conditions and these are patients who require to be seen on a long-term basis and require regular medication. Now, this is a group of patients that are also highly vulnerable to the infection of COVID, in that they still have the same risk as everyone else to get that infection, but unfortunately they are at a high risk of very severe disease if they were to get the infection. Mm-hmm. And as a consequence of that, these are patients in whom we actually have to be very keen about their follow-up and protecting them against basically getting the infection.
Mm-hmm. Actually, there's been concerns about, and people are still learning a lot about COVID-19 and the issue about it causing a state of, I'm trying not to be very technical here, but people are at risk of having clots in various parts of the body, and that is probably one of the mechanisms in which it is causing severe illness and it's causing death. Is this a point of concern for people with heart disease?
Yes, it is. There's a number of mechanisms by which it's actually causing severe disease. The excessive clotting is one of them. The other one is where they have excessive inflammation, particularly in the lungs, and therefore they develop difficulty breathing. And for patients who already have a problem with the heart, it's not able to actually cope with the extra load, and therefore they actually deteriorate. So you find that for those patients who actually have an underlying condition, a cardiovascular disease, then their complication rates actually go even higher once they catch this particular infection.
Mm-hmm. And for particularly discussing Kenya, we know hypertension has been high on the list of people who have succumbed to COVID-19. Are there any other cardiovascular diseases which are also susceptible or equally susceptible to COVID-19, and which ones are these?
Well, cardiovascular disease is a group, is a very broad description of a broad variety of conditions. So, for example, hypertension is quite prevalent in our population. But in addition to that, we have heart failure. We also have those patients who have rheumatic heart disease, which is actually affects a much younger population. And these are patients who, in the event they were to get the COVID-19, we would actually have catastrophic results. We also have patients who have pulmonary embolism and pulmonary hypertension, that is problems with regard to their lungs. And we have patients who have poor blood flow into their legs. So all of these patients are at risk of severe disease.
Okay. And looking at generally what COVID-19 has done, and we've seen people have lost their jobs, we've seen people have suffered serious pay cuts and they are unable to meet some of their needs. And we know that people with a chronic disease, these are people who regularly need to keep up with their medicines. How are they able to live through this time, knowing that keeping up with their medicine is something really important, and yet here there are all these other challenges that are coming up because of COVID-19?
One of the things that we are actually doing, both as KCS but also as a general medical community in Kenya, is we're encouraging patients to stay at home as much as possible, try and keep healthy, maintain a healthy lifestyle, do at least some exercise around the home while ensuring that you maintain safety by wearing a mask and maintaining social distance. But in addition to that, if the patient does not require to come to hospital, we actually have teleconsultation. So you can call your doctor and you can discuss any issues that you may have. For those patients who have a good internet connection, then we can also actually have a virtual consultation. And for those patients who are seriously unwell, then they actually have to come in and see the doctor. But we all make sure that we maintain all the necessary precautions. You wear your protective gear and you ensure the patient is masked and maintain social distance. And in addition to that, there are actually apps that are available for patients to be able to get their drugs delivered to them, and also other apps that also allow for teleconsultation.
Okay, all right. Dr. I'll let you pause there as we join, as Mr. Edward Konzolo joins us via way of phone. And Mr. Konzolo suffered a stroke in the year 2012. Mr. Konzolo, just tell us actually what happened that you suffered a stroke 8 years and counting.
Yeah, for me, I suffered a stroke in 2012, and I was teaching. I was a teacher at the secondary school teacher, and when I woke up in the morning, I felt some dizziness, and then I collapsed after some time. Then it took me about 20 minutes. I woke up once again. Then when I thought everything had come to normal, I got also I collapsed once again. It's when my friends thought, no, it's bad, we better go to hospital. I went to a hospital in Nairobi here, and I was told there's nothing, they are not seeing any medical problem with me. Then I told them that I've felt some weakness in my body, in my right hand and leg. They told me now they are not seeing anything. So I removed my card, the insurance card. Then the doctor said, oh, okay, if that's the case, then we better put you in the ward for 24 hours. We observe you. They took some samples from me. It was about 11 in the morning. And then from that up to 8 at night, I wasn't given any drug. But when a nurse was making a round, that's when he found at about 8 in the evening, he found that I was sort of somehow paralyzed, because now my right hand, my right leg couldn't work, even my mouth couldn't work. So I was there just like that. It's when the doctor came at Satatu Siku and administered some tablets on me, and then left me to spend a night in that particular ward.
And then it's after that they carried out further tests and the scan, and they confirmed that you had actually suffered a stroke because of high blood pressure that earlier on you didn't know that you had. So after they made the diagnosis that now you have high blood pressure, what
Yes.
kind of treatment and therapies did you have to undergo to get you back to the way you were before?
They gave me some tablets, which I've been taking, and then they told me to be taking some, to be going in for this thing, for what? For physiotherapy, which I've been attending up to right now. It's just, but when it came to March, and this coronavirus thing came in, is when I feared even going now to hospital for my physiotherapy.
So how have you been able to keep up with, because it's important that you continue with your treatment, with your medicine, and at the same time, it's important that you keep yourself safe from contracting COVID-19. How have you been able to balance these two things?
It is a bit difficult, but my chairman, of course, when we formed the association, my chairman is able to get some drugs from the hospital, and then he gets me some of the medicine. Yeah.
Okay, and here I'll bring in Dr. Nguchu. As Kenya Cardiac Society, and you're an executive member of the society, how are you able to support patients during this obviously critical time, because you still want your patients to live as normal a life as possible, and at the same time make sure that they do not contract the virus?
Some of the steps that are being taken is we are having what we call webinars, where we are trying to train all health workers, all the way down to the level of the nurses and the clinical officers, in how to manage some of these patients so that they do not have to be necessarily referred to Nairobi for medical management. We have the cardiovascular guidelines of Kenya that were actually launched and we are currently in the process of disseminating. With regard to patient education, we are hoping that with each teleconsultation we have with each patient, we try and educate them and address any fears and concerns that they might have about contracting the virus and some of the steps that they can take to protect themselves. We do emphasize that patients should continue with their medications, and some of the patients have actually also been trained in how to take their blood pressure and how to check their blood sugar for those who need to check it, and essentially monitor for symptoms so that if they need to come and see the doctor, then they can at least first have a teleconsultation and then will be advised further.
So in the event that somebody suspects that they could have contracted the virus or they're having flu-like symptoms, what advice do you have for patients with cardiovascular disease?
If they do develop those symptoms, then we do encourage them to go and get tested. There is, of course, the number that you can actually dial, the Ministry of Health number, that would actually help to facilitate these patients. But there are various health centers and health facilities that the government has provided where they can go in and get tested.
Okay.
Yes.
Mr. Konzolo, since then you've been with a group of others, you've been able to form the Stroke Association of Kenya, of which you are the secretary. But how else has your life changed since getting the stroke in 2012?
Now, my life has changed a great deal in that I was a teacher. Now I'm somehow jobless. So, you know, even the functions at home have now changed. I find that it's very traumatizing in a way. Then also, hello?
Hey, you, Mr. Konzolo, continue.
Okay. In fact, you find that it is very traumatizing to be at home without this thing of with the unemployment. So I joined a group called NCD, Non-Communicable Disease the Communicable Alliance of Kenya, which has now kept us busy. Every day we are holding our Zoom meetings and knowing what other people are doing around the country. So I find that one is very much okay. Yeah.
So as we wrap up, being somebody obviously who has gone through a lot due to high blood pressure, due to the stroke, what advice would you have to somebody else who is watching and listening, who's also going through the same, especially during, as you said, this difficult time where it's uncertain time and you never know how or where you can get this virus?
My advice is to such like people, they should take care in the sense that we are the vulnerable group. Things like wearing the mask is always a routine, and then keeping distance and keeping at home, whereby if you must keep at home, you better keep at home. And also, you must attend to your physiotherapy or clinics. When you feel unwell, you just go to a hospital to be treated of that particular ailment.
Okay. Thank you very much, Mr. Konzolo, a stroke survivor and Secretary of Kenya, Stroke Association of Kenya. And Dr., your closing comments, what do you have to tell people with cardiovascular disease and potential anyway, because as we say, hypertension is a silent disease. So anyone really today, you may not know, but tomorrow you may actually have hypertension. What do you have as your closing comments for people in this category during this pandemic?
Well, for one, is for them to maintain their medication as prescribed. Two, in the event that they should feel any symptoms, then they should not hesitate to actually get in touch with their doctor. Three, we are glad that the MOH has maintained the NCD clinics open, and so patients should actually maintain their appointments, while at the same time adhering to the strict rules of masking and maintaining social distance. At the end of the day, even as we go through this pandemic, we have to remember that these non-communicable diseases are there with us, and we still have to manage them.
Okay. Thank you, Daktari. That is Dr. Karemi Nguchu. Dr. Nguchu is a consultant cardiologist and an executive member of the Kenya Cardiac Society. Earlier on phone was Mr. Edward Konzolo, who's a stroke survivor and the secretary of the Stroke Association of Kenya. And we are discussing the issues of cardiovascular disease and the issues of concern during this COVID-19 pandemic. But the message is all the same. Wear your mask in all public places. Wash your hands with soap and running water. If you do not have access to soap and running water, use a hand sanitizer and maintain physical distance. But keep the social interactions going on via all these available social mediums of interaction. That is WhatsApp, or it could be Zoom. Social interaction is key for mental health during this COVID-19 pandemic. So for everyone who might have cardiovascular disease, everyone with hypertension, remember to keep safe during this particular COVID-19 pandemic. People with cardiovascular disease, people with hypertension have been a majority of the people who have succumbed to COVID-19 and are at risk of suffering severe to critical illness when they contract the coronavirus. I'm Dr. Mombasa Road. We take a short break here on Health Digest. There is more for you on Doctor's Diary and Nutrition and Fitness.